interest in the flu vaccine going up because of coronavirus, and are people getting flu shots earlier than they normally would? NewsChannel 8's Burt Mummolo reports on COVID's anticipated impact on this year's flu season. Burt?
Hoping to avoid a double whammy, Neely. The thought of catching the flu and COVID could be spurring demand for flu vaccines. The banner out front is standard for this time of year, but the demand they're seeing for flu shots at caring nurses isn't.
The last 2 weeks, our calls have significantly increased.
People wanting to know if the flu vaccine is ready and when they should get it, especially since that other virus is out there as well.
I think everyone's concerned that we have 2 different viruses circulating now.
Over at the urgent care at 97th and Riverside,
if it's positive, it'll take like 2 minutes, but if it's negative, it might take like to 10.
Their COVID testing machine has been keeping busy and drawing a contrast to how people view this virus versus the flu.
When people come to a clinic to be tested for the flu, they're sick. They have no reason to come get a flu test when they're not sick. And so it's a whole different mindset.
Dr. Nussbaum tested positive for COVID at the end of June and uses his own experience to enlighten patients.
It's kind of interesting because now I can explain to people that, hey, I had it, I survived it, I'm doing fine, which is the case for, the vast majority of people.
Back at caring nurses, flu vaccines aren't the only vaccines people are talking about.
We have a waiting list already for people who want the COVID vaccine.
The list began about a month ago. Renewed interest in vaccines for both the future and the present.
The majority of adult Americans don't get a flu vaccine, and I am hopeful that that will change.
And as people get vaccines earlier this year, some healthcare providers are urging folks to get another flu vaccine in December, basically as a booster shot. Reporting live, Burt Mummolo, News Channel 8.